Hey everyone, welcome back. Today we are going to be talking about dermal fillers, one of my favorite treatments here at Ali Inani because of its immediate gratifying results. And I combine treatments here at Ali Inani, fillers, the neuromodulators, and then lasers and RF microneedling. And so Mehana has a list of some of the most frequently asked questions for our patients, and as in the previous video, I will try my best to answer those questions. Okay?
Okay, first question. Where can I have fillers injected?
Oh, okay. Where you want it. And anywhere in the face that needs revolumization, needs correction, and needs contouring. So those are the areas. So for example, the cheek area, and then the lips, the chin, jawline, tear trough. But my approach in fillers is not to overfill patients because that would look weird. That's gonna make you look like an alien. Moon face, manapua. You don't want to look like a manapua. That's like a bun here in Hawaii. Why? It's one of our favorite food to eat here, right? The manapua. It's so puffy. We don't want that. And I combine that typically with neuromodulators and some other anti-aging treatments that I do here to produce a more natural looking results.
Okay. How many fillers do I need?
Oh, it's case-to-case basis because every patient is unique, and I see patients from their 20s all to their 70s. Okay, so but majority of my patients are on my age group, which is Gen X and above, baby boomers, late baby boomers. Okay, so it depends on the overall situation. I would say if you need more correction, then you will need more fillers. I use different fillers for different areas of the face depending on the expected outcome and also the concern that we're trying to address. So say for example, I like using Restylane Lift for the jawline, chin, and also for the cheeks. The classic one, good for the lips, and I can also use this for the nasolabial and also very good tear trough. Versa is another good filler that I use, and Delotero, I use this mainly for the tear trough and smoker lines.
Will I look unnatural?
No, with a right injector, of course. So my approach, like I said here at Linani, is to make you look younger. As my patients tell me, Marie, I'm not trying to look like I'm 25, which is true. We just want you to look younger. I'm gonna be 47 in 2 weeks. I just want to look good for my age. So therefore, I'm not gonna overfill. I'm not gonna make myself look like a manapua or an alien. Otherwise, you don't want to come to see me. But I want to look natural. I want to have less wrinkles. I want just a little bit of youth, for my face. Fillers is, I would say, part science because you have to know the anatomy. You have to be a safe injector first and foremost. But for the most part, it requires eye for detail, artistry, because you don't want to really alter the face, the natural beauty, so to speak.
Does it hurt?
Little discomfort. I always tell my patients every time you come see me, there's little discomfort because I'm doing something, okay? Even though I say it's non-surgical, non-invasive, but the fact is there's something going on. I use cannula in most of my filler treatments. What I do to minimize the discomfort is to inject lidocaine first. Sometimes we do a topical numbing, but oftentimes that is not really needed. And then I also have other numbing tools. We have the beauty vibrator. We have Mihana that also assists during procedures if she can, kind of like reduce the anxiety and nervousness, especially for first-time patients. But overall, it is a well-tolerated procedure. No one has walked out yet. No one cried a river. And I'm a slow injector because I want to make sure that you are feeling okay.
Is there anything I should do before my treatment?
Oh yes. Every time you get poked by a needle, there's always a tendency to bruise. That's given, okay? So how can you avoid bruising? Well, don't drink, don't drink wine, alcohol, if it's not contraindicated by your primary care physician. So aspirin, blood thinners. Bruising, I would say, is a minor concern. If you want to do the fillers, do that at least a month before a big event. What other things that they can do before, right? Well, don't come very hungry, okay? have a light meal before coming here, especially if it's your first time. It's always a fear of the unknown, so that kind of lessen the feeling of being nauseated during the procedure. You can watch some videos too that we post here regularly on the Inani and also on my own Instagram. We have our YouTube, so that it gives you an idea what happens during the procedure.
And what should I do after my treatment?
After your treatment, okay, this is very important. I always give my phone number to my patients because right before I discharge you, I make sure that there is no vascular compromise. Before I release you, I assess the area that I injected, and also the surrounding areas, just to make sure we have proper oxygenation on that area. Drink lots of water to facilitate accelerated healing, and also hyaluronic acid loves water. Okay, so that the filler will integrate nicely into the skin, and when I see you in 2 weeks, everything looks good.
Can I combine fillers with any other treatments you offered at your med spa?
Yes, that's what I do typically. Okay, so injectables, for example, we can do Botox and filler on the same day.
How much is the treatment?
Oh, that one is the most frequently asked question, which I cannot really answer you unless you come in for a consultation. Why? Each patient has different concerns. Each area may require a different number of syringes. So the best thing is to come in for a consultation. That's it for now, and I'll come back to you with another set of frequently asked questions. You have a wonderful day.